first visit. And this is a little tricky because you have scoliosis, so it starts to curve off over here. So over here, you have this scoliosis that's happening over here too, right? If we can tip this down, imagine what that does for everything else, right?
Okay.
Basically, when we give breathing exercises, when you breathe, you actually breathe through this one.
Okay.
So your tendency is going to be to breathe through this.
Okay.
But we want to actually breathe through here.
All right.
Yeah. So it quickly turns over here. So if we look, that's basically the pattern of the scoliosis is going down that way. So we got this curve over here. And the reason the rib hump develops over here, just so you know, is because it's rotated, like it's rotating your ribs.
Okay.
So scoliosis actually rotates your spine, so it actually rotates your ribs out. It's pretty common from the side with people who have thoracic rib humps to see basically ears like far forward of your shoulder, because this actually, basically there's a hump that develops over here too, right? But it's not that we just want to pound that, we want to try to correct as much of what's actually happening. We see that there's some sort of break over here. Yep, right there. Okay, so we'll check that out. Okay, so something is going on over there too. But you have to differentiate. It's going to be harder to feel swelling because of the hump that's pushing out the musculature. So we just have to go a little bit closer into where the nerve roots exit. So is that tender here? Yeah. It's swollen over here, but because your musculature and your ribs are popped out, and there's so much tissue over here, we have to be very careful with when we actually feel. Yeah. So this is all the musculature, but if we get right here, that's where the nerve exits, and that's where you feel a little tender. Yeah. So I'm gonna work on T7 over there, and let's see what's going on over here. Just relax here. This is 0.5, 0.4. Is that tender right here? Yeah. That's painful. Okay. How about the one below?
Just a little bit.
It's more the one above?
Oh yeah.
Okay. Looks like we got our prime suspect. Okay, so you're just gonna relax here. I'm gonna give this a push like this, okay? So you just relax your shoulder just a little bit. I gotta feel where it goes. Good. Just relax your belly, okay? And then just relax a little bit more. I'm gonna have to push this like over. Good. Okay. You good? Yep. Okay. You felt that, I'm sure?
Yeah.
Okay. I'm actually going to do a little bit more so that we got that, but I want to get that a little deeper into here. So, you ready? Okay. Good. Come on up. That was the rest. This is the one I adjusted. Okay. If you look at this one, you see how this one is almost like slipped this way? So you see how they're kind of lined up? And then this one is kind of like, it's slipped that way? So we have to be careful because this is what's called the side slip of that vertebra. Okay, so basically what I don't want to do is come from this side and push that even more from that side, right? So what we do is actually, we have to actually push that, so it's, even though it's like coming out like this, right? What I actually have to do is basically go like that with it, right? So I have to kind of do that and push it over that way. So just with the Gonstead method, we're really looking at multi-vector approach. Right? So when we're actually talking about that, we want to go exactly opposite of what we're seeing.
Yeah, you're right.
That's why we look at the X-rays every single time. Yeah, to make sure we're on that. So that's your T7.
Okay.
So adjusting that and adjusting over here, exactly opposite, pushing that over, is really what we're going to be doing for you today.
Okay, perfect.
So how's it feel?
Oh, feel good.
Yeah, so that's what we want to do, is really find things before they happen, but also make sure we fix the structure basically opposite of what we see on there, right? Okay, go on.